Does an HPV infection have long-term health implications? Imagine catching a virus that could quietly stay in your body for years without you knowing. Human papillomavirus, or HPV, is one such virus. It's incredibly common, and most people who get it never experience symptoms or health problems. But the story changes when certain types of HPV stick around over time. Some high-risk HPV types, especially HPV 16 and HPV 18, can persist in the body and cause cellular changes that might lead to serious health issues down the line. Most HPV infections clear up on their own within 1 to 2 years thanks to your immune system. However, if the infection with a high-risk type remains, it can cause changes in the cells of the cervix, vulva, vagina, penis, anus, or throat. These cellular changes are called precancerous lesions. If left untreated, these can develop into cancers, with cervical cancer being the most well-known. It usually takes about 5 to 10 years for these precancerous changes to turn into invasive cancer, but in some cases, it can take longer. Because high-risk HPV infections often cause no symptoms, regular screening becomes essential. Pap smears and HPV tests help detect early changes before they become serious. This is why routine checkups are crucial, especially for women, to catch any issues early and prevent progression to cancer. It's important to understand that not everyone with a persistent high-risk HPV infection will develop cancer. Factors like smoking, weakened immune systems, or other infections can increase the risk. For example, people living with HIV or those on immunosuppressive medications are more vulnerable to HPV-related complications. While there is no cure for the virus itself, the effects caused by HPV can be managed. Treatments are available for genital warts and precancerous lesions. Vaccination is a powerful tool that can prevent infection with the most dangerous HPV types, significantly reducing the risk of related cancers. The vaccines are most effective when given before exposure to the virus, typically recommended for preteens but also for young adults. In the context of reproductive health, HPV is a major cause of cervical cancer, which remains one of the most common cancers in women worldwide. It also plays a role in other reproductive cancers, such as cancers of the vulva, vagina, penis, and anus. Although HPV is not linked to testicular cancer, understanding its impact on genital health is important for both men and women. To sum up, persistent high-risk HPV infection can have long-term health implications, primarily through the development of cancers. Regular screening, vaccination, and healthy lifestyle choices can greatly reduce these risks. If you have concerns about HPV or your reproductive health, it's always best to consult a healthcare professional who can provide personalized advice and appropriate screening options. Remember, staying informed and proactive is your best defense against the potential long-term effects of HPV.